Hi, my name is Alexandra Neikam. I'm going to be talking to you today about my quantitative research article, which was entitled The Different Lying Positions and Their Effects on Tissue Blood Flow and Skin Temperature in Older Adult Patients. So the significance of the problem. The purpose of the study was to compare the effects of the different lying positions on tissue blood flow and skin temperature in older adult patients. We specifically looked at older adult patients because they're more at risk for pressure ulcer development. Pressure ulcer formation is common in the hospital setting, primary care, and community health services. Pressure ulcers are important to monitor because they cause pain, they extend patient stay, and they increase demands of care in the hospital setting. Here I have a picture of the progression of a pressure ulcer. There's the different stages which you can reference if needed. So the research critique. There was no conceptual model or framework used in the study. The design was a pilot study, so it's going to be used later on in a larger study, and it's a descriptive comparative design. The setting, the research study took place in a university hospital in Sweden. Patients were recruited by nurses from different units, from the neurological, medical emergency, and geriatric units. The sample, it was a convenient sample totaling 20 patients, 10 men and 10 women. The inclusion criteria were if they were over the age of 65, considered elderly, and if they were able to lie in all 6 positions required. I have a picture of the 6 positions on the right. The exclusion criteria, if they had a fever greater than 37.5 degrees Celsius, if they had a history of pressure ulcers, if they had an existing pressure ulcer, or if they had skin damage to popular pressure ulcer areas, including the sacrum, the trochanter areas, and the gluteus maximus. Variables. So the independent variable was the different lying positions that I had showed you. The dependent variable was pressure exerted on the body, tissue blood flow, skin temperature, the patient's individual weight and height, their risk for pressure ulcer development, their blood pressure, and the body temperature. So data collection procedure. Data was collected between March and October of 2010. Data was collected using a 2-channel PPG instrument which assessed the blood flow. Within each instrument there was a sensor that assessed skin temperature. There was a thermometer that was used to record the room temperature, and the procedure. The probes were placed on the patient, and then they had to lie in the 6 positions for 5 minutes. So the ethical components. The study was approved by the Regional Ethical Committee, and before being a participant in the study, the researchers obtained informed consent from the patient and the patient's physician. The results. So there was an increase in blood flow regardless of position or location. The blood flow decreased greatest at 30 degrees lateral position over the trochanter area, and blood flow changes were greatest over bony prominences, which was already known. Limitations of the study. So an increased skin temperature could have been due to heat accumulation from the patient lying in bed. Movements by the patient during evaluation could have influenced the results. The time factor, if they were laying in bed for a longer period of time, definitely results could have been changed. And then the medications. Each patient is on a large set of medications, all differing, so that could have an influence as well. Implications for nursing practice. So we already know the importance of turning and repositioning patients. It's important for pressure ulcer prevention. We need to have turning intervals in place, and we also have to have further studies in order to evaluate the effects of different lying positions over time. And these are my references, so thank you.